So with fears growing about the spread of the coronavirus, President Trump announced yesterday that Vice President Mike Pence will be placed in charge of spearheading the government's response to the virus. Earlier today, I had a chance to sit down and speak with the Vice President at CPAC. Let's take a look. Mr. Vice President, good to see you. Let's talk coronavirus. Let me just read opinion piece, New York Times. I know your favorite paper. Let's call it the Trump virus. If you're feeling awful, you know who to blame. I look at the media reaction to this. I look at the Democrats' reaction. It's almost instantaneous. You know, they're politicizing what is obviously a serious issue. Your reaction?
Well, look, the president made it clear yesterday. We're all in this together. This is not the time for politics. And after the president asked me to lead the effort on the corona response from the White House, working with the task force that he established now a month and a half ago, working with state government officials and local and health officials, the president also directed me to reach out. I spoke to Speaker Pelosi. I spoke to Senator Schumer, as well as the Republican.
How did those conversations go?
They were good conversations.
They were, because they were politicizing it almost instantaneously.
Yeah, I know. But look, you know, the president said to me, look, I want you to reach out to the Republican and Democrat leadership, because we want to push politics aside. We want to make sure we get the resources that we need to respond to this, to make sure the CDC, all of our agencies have the support that they need, that states have the support should this matter become more serious. But you know, the president's message is very clear. We're ready. We're ready for anything. We continue to prepare for whatever may come. But the reality is that because of the actions that President Trump took last month, literally, you know, ending travel, closing our borders to people coming in from China, establishing a quarantine process, setting up a task force. I mean, if the president hadn't taken those unprecedented steps,
they didn't seem to like it then.
We'd be in a very different place today, Sean.
Both, you mentioned Pelosi and Schumer, both have been critical of the president on this and about the money, and it's shameful. I don't think they supported closing off people coming into the country from some of these countries.
Well, look, and there was criticism last month, but when we first received word of the outbreak of the coronavirus, shortly after the first of the year, the health team came in. I was there in the Oval Office, and they said to the president, look, what we ought to do is we ought to end air travel, we ought to close our border, and we ought to establish a quarantining process for any American citizens that we allow back in. And they said, no president has ever done this before, but we're recommending, out of an abundance of caution, that you do it. And President Trump didn't hesitate for 1 second. He said, do it. And it was criticized by some at the time. But as I said, our health experts told me again yesterday when we huddled right after that press briefing for the first time. They said we would be in a very different place today if President Trump hadn't taken the decisive action that we had. And today, you know, we haven't had a new case for the last 2 weeks until the word that reached the public in the last 24 hours. We've had 15 cases in this country, and people are being treated and doing well. One is still in the hospital. But the other 45 cases are all American citizens that we brought back home, went through a quarantining process. We're monitoring them. So I take my hat off to the president's leadership, as well as to Secretary Azar, the team at CDC, Homeland Security. This has been a whole of government approach, but when the president tapped me to lead the White House effort on this, I think it just demonstrated again to the public the seriousness that the president's placed on this. He's telling us to lean into this effort out of an abundance of caution, because he has no higher priority than the health and safety of the American people.
You get criticized right out of the box. When you were in Indiana as governor, the issue of needle exchange came up with HIV. Right. And I don't know if you would really care that Congresswoman Ocasio-Cortez, you don't believe in science. Needle exchange programs are pretty controversial. And it was a tough call for you at the time. What does it mean, all hands on deck?
Yeah.
And do you think that the Democrats will really work with you, or are they looking at yet another opportunity to just slam Donald Trump? I say on the program often that if Donald Trump cured cancer, they would want to impeach him for that. obviously a little hyperbole, but I sense a certain truth in it, that people see a political advantage if, in fact, oh, this got to be bigger, or it impacts the markets even more?
Well, we want to hope for better. We hope for a better outcome on this issue clinically, the spread of the virus, although the president said we're ready for anything. And we continue to hope that we'll see not just Republicans but Democrats dial down the rhetoric and come alongside the president as we work the problem. That's going to be our objective. We'll be working on Capitol Hill with people in both political parties.
It's hope already, by the way. You did see the Wall Street Journal. They have the company out of Massachusetts that is already, they feel they may have a track to a vaccine on this. Well,
and that's all part of this equation. But, you know, I will tell you, I spent 12 years in Congress. I know how political the place can be, and it seems more divided now than ever before. But I will tell you, in my conversations with Republican and Democrat leaders, I think we have an opportunity. We have an opportunity to do exactly what the American people want us to do, and that is keep the politics out of this, follow the facts, follow the science, and work the problem. I think one of the reasons the president asked me to do this was precisely because of two different incidents in the state of Indiana. In 2014, Indiana was where the very first MERS case emerged in the country. MERS even more dangerous than coronavirus. As governor of the state of Indiana, I saw the way that local government, law enforcement, health officials, and the CDC can work in concert. And we secured that patient. We worked backwards to anybody that they'd contacted, and there were no further infections. And then in 2015, we did have, in a small town in Indiana, a rise in incidence of HIV/AIDS. And it was all directly coming from people sharing needles in intravenous drug use. We worked the problem early in the year from a law enforcement standpoint, from a health standpoint. I don't believe in needle exchanges as a way to combat drug abuse. But in this case, we came to the conclusion that we had a public health emergency. And so I took executive action to make a limited needle exchange available.
At that time in that location.
At that time in that location. Indiana would go on to change the law to mirror what action I had taken. But it was a moment where we had brought all the resources to bear, first from a health perspective, a law enforcement perspective. And I'm glad to say that we were able to get all of those people treated. Everyone was able to get support and help, and we moved forward and the community recovered.
For the American people that are worried, that are concerned, reading about this potentially spiraling out of control, the impact on their 401ks, the stock market, obviously, the concerns about the global economy, you say to them today?
The risk of the spread of the coronavirus in the United States of America remains low. That's according to all of our experts, and it's a direct result of the unprecedented action that President Trump took last month when he closed our border to Chinese individuals coming into the country and also established a quarantining effort. Our White House coronavirus task force has literally been meeting every day for the last 6 weeks. And the American people can be confident that we're going to bring, at the president's direction, the full resources of the federal government to bear to protect the people of this country. That being said, during this time of year, it's always a good idea to engage in best practices, and people can go to cdc.gov to get the latest information on not only this virus, but how they can best see to the health of their family and their community.
Vice President, thank you for being with us. Appreciate it.